Oh, it is. Okay. Good morning. On behalf of our RDIC team, which consists of Gord Heidel, Renette Edgar, Troy Wist, and myself, Doug Stamen, we'd like to welcome Dr. Michelle Stamen from Prairie Sky Integrative Health. She's here this morning to discuss naturopathic medicine. She'll touch on the educational requirements, specific therapies used in her practice, opportunities in the fields, and similarities and differences between conventional and natural medicine. A reminder before we begin, please complete the survey by using the QR code or go to our website at rdiec.ca. So take it away.
So, hi everyone. Thanks so much for joining today, or if you're viewing from YouTube and afterwards. I'm happy that you guys have an interest in naturopathic medicine and want to learn more about it. So first here, what I'm going to do is I'm just going to share my screen so that you can see the PowerPoint here. Okay, awesome. And let's see if we can I might actually just leave it like this, to be honest. Okay, so yes, so my name is Dr. Michelle Stamen. I'm a naturopath in Regina, Saskatchewan at Prairie Sky Integrative Health. And yeah, today we'll be talking all things naturopathic medicine. So on the agenda today, we'll discuss, what is naturopathic medicine and what do we do? Some of you may be familiar. Some of you, this might be something completely new to you. It is a growing profession. We'll talk about the history of naturopathic medicine, our education, what that would look like, some different case examples so you have an understanding of kind of how we approach things in practice. We'll answer some questions, and then like Doug Stamen had said before, we'll fill out the survey at the end as well. So what is a naturopathic doctor? Well, we focus on a blend of modern scientific knowledge with traditional and natural forms of medicine. It's really based on the healing power of nature and the body's ability to support and heal itself. And so the education, the summary here, which we'll get into in more detail later on, is that you need an undergrad degree that's required to get in for the schooling. And then the specific naturopathic medical schooling is a 4-year full-time accredited medical program. And the training includes basic medical and clinical science, diagnostics, naturopathic principles and therapeutics, and extensive clinical experience under the supervision of qualified naturopathic doctors. Up here. Okay, so what is alternative medicine? Well, it's under this branch of like complementary integrative medicine, and it's all treatments or therapies used in place of or alongside conventional medical treatment. So this is something that I think people have to differentiate as well, is that it doesn't have to be one way or the other. We don't have to just do conventional Western medicine the way that if you go to your family doctor, that's kind of what we're used to over here. We can also use that alongside with these other therapies. And so naturopathic medicine kind of falls into that alternative therapy category. And it's like basically adds value of addressing illness through a comprehensive assessment, diagnosis, and treatment plan. And a regulated and licensed naturopathic doctor, we really aim at treating the whole person, determining and treating the underlying cause, so always getting to that root cause of what could be going on. And symptoms are viewed as expressions of the body's natural attempt to heal. So what can a naturopathic doctor do for you? So at the appointments, let's kind of go through that first. So our initial intake with a naturopathic doctor is typically 1.5 hours to 2 hours in length. So at our clinic, we do the full 90 minutes as our initial intake. And we really want to take that time with patients to understand, your family history, your lifestyle. So that includes like stress, exercise, diet, really trying to tease out all these different variables that could play a role in your health, the stressors in your life, past medical history, the medications and supplements you're on, because like I said, although we don't prescribe medications personally in our practice, we are trained to work alongside medications that have already been prescribed to know, if there's going to be any interactions with things that we want to prescribe from a supplement or nutritional standpoint, so we can work alongside whatever conventional medicine you're doing at the moment as well. So we also want to take into account the history of accidents or injuries and the significant events in your life that may have affected your health or well-being. And we may also use different questionnaires and different things like that to kind of get more of an idea of where things are at. So basically, we really want to focus on disease diagnosis as a big aspect of what we're going to obviously try to accomplish in clinic. We can requisition blood work. So that is the same type of blood work that you get through your MD. And so that is something that we have access to. We also like to use specialty lab testing, which is something different than what physicians in Canada typically use. With public health, they don't really take advantage of that because it is through private companies in Canada and the States. In the US, a lot of practitioners do use these specialty lab testing, but that isn't the case in Canada. So we're kind of one of the only ones that really dive into the specialty lab testing field. And that can be anything from like heavy metal testing, comprehensive stool testing, looking at the whole health of your GI tract, comprehensive hormone testing, food sensitivities, nutrient mineral status, and nutrigenomics. So like how your genes affect your nutritional breakdown and what foods you should be eating for your genes. So a lot of different interesting things that we can kind of add in to get more information when we're looking at a patient's treatment plan and how we can address things. So different things that we offer as well for treatment would be botanical medicine, nutrition, hydrotherapy, homeopathy, Chinese medicine and acupuncture, lifestyle counseling and health promotion, and disease prevention. And then, as I kind of alluded to previous, it's the education piece. We spend a lot of time with patients to really try to help them understand what's going on with their health and helping them learn more about it and what they can do. So it's that's a huge piece because we really want to spend that time instead of people leaving the office and being confused as to where they're at and what the treatment options are. We really want to take that time to walk them through all that. And I'll go into more detail on all these different modalities later on here. So who should see a naturopathic doctor? Well, I mean, honestly, I'm biased, but I would say everyone should have a naturopathic doctor on their health team. So just as you would have your family doctor that you go see, you should still have a naturopathic doctor, like a massage therapist, a chiropractor, osteopath, all these other practitioners as well to help work alongside the treatments maybe you're already having, or just to optimize health, like overall, if you don't really have many concerns. Really, I think there's always going to be something that we can work on. I've had many people come and are like, oh, I'm healthy. I don't really have anything to worry about. And then we start diving into it. And in that hour and a half, we find that, like there are a lot of things we can still improve. And maybe your idea of your health and where things are at, you're just very used to, and you don't know how good you could feel if we optimize some of these things. So yeah, like whether, you're looking for disease prevention and health promotion strategies, you have undiagnosed symptoms, you've already been diagnosed with something, often serious or chronic, and you're just looking for other treatment options, or you're looking to combine that conventional approach with the naturopathic approach. So those are some of the reasons why people come see us. And so, yeah, this is a list here of different things that we see, but yet again, I would honestly say, unless it's something serious and acute, like obviously you go to the hospital, you get that dealt with immediately, but any of the things between that and super chronic conditions, I really think we should be taking into account the naturopathic side to really help that health promotion and those preventative strategies to really optimize your current health state. The only one that I don't personally deal with in practice is cancer. There are certain NDs in Regina that really focus on that because that's kind of a whole realm in and of itself. So personally, that's the only thing that I don't see. I would refer to that other naturopath. But that being said, if that was something that interested you, you definitely can take that as a part of your practice. So I just wanted to go through a couple case examples throughout as well to give you some ideas. So this is a patient I had. She was like a 30-year-old woman. She came in for mania, like suicidal ideation that involved her children. It was a very serious situation, and she was seeing psychiatrists. She was doing everything that she was supposed to be doing, But she was very fed up with the medication side of things. And they were wanting her to go on 4 different psychiatric medications, which she refused to do because of her past history with them. And it was just her choice that she was like, you know what, like, I just don't feel comfortable with this anymore. She was completely, she like exhausted and just felt really crazy and unpredictable. When we went through her blood work, she had super low iron and chronic GI issues and rashes. And we saw that her gluten antibodies were absolutely off the charts. What should be under 20, they were above like 8,000. So we really took that holistic approach of, okay, if there's some gluten intolerance going on, potentially celiac. She didn't actually get the biopsy that would confirm that. But we removed gluten, supported her gut, replaced the iron, did all these supportive things to build up her health. And honestly, she just completely made a 180. It's still, obviously, with any health condition, is a work in progress. But where she was then to where she is now is amazing. And she did not end up going on medication. So there's a lot that can be done. That was a much more serious example, but it was really cool how we were able to look at, you know, the nutrition side, the supplement side, all these different things, and with testing to see like, oh, well, that could be what could be making you feel not great. So that was an interesting example. So we'll touch on the history here. I mean, it started all with Hippocrates, which was a Greek physician who lived 2,400 years ago. And he was the first one who came up with the concept of the healing power of nature. And in North America, it was really traced to Dr. Benedict Lust, and he used the term naturopathy to describe a clinical practice, which they would use like botanical medicine, homeopathy, nutritional therapy, manipulative therapy, acupuncture, lifestyle counseling, all these other things. And kind of since then, it's grown so much. So the first 4-year full-time program was 1983. And even since then, like the schooling has changed so dramatically. And we will get into that later on, because it started out, which some people might have heard too, is just like it started out very, very natural, to the point where it wasn't at all similar or on the same page as like medical schooling. Versus now, even though we still focus on these different modalities, the actual schooling is very similar in terms of, you know, making sure we have all those bioclinical sciences and all those things that are comparable to a conventional medical school. So we'll get into that further later on, but that's kind of how this all began. And so, yeah, today more than ever, people are seeking and benefiting from naturopathic medical care, and the number of naturopathic doctors is growing at record rates. There are currently about 2,400 naturopathic doctors in Canada, and it's growing all the time. So this is something that has really picked up in the last, 50 years, I'd say, and is something that's so crucial in society's health. So yeah, naturopathic doctors are experiencing greater recognition as healthcare practitioners and as experts in the field of natural and preventative medicine. They provide leadership in natural medical research and are politically active at the federal, provincial, and territorial levels. In Canada, there are 5 provinces that regulate the practice of naturopathic doctors, and that is BC, Alberta, Saskatchewan, Manitoba, and Ontario. So you may be wondering, okay, what about the other provinces? Well, since they're all regulated slightly differently province to province, some are still in the process of even regulating naturopaths. So there's lots of changes always being made. Those 5 are the ones that we're regulated. We have our own associations. We have our boards that, manage the naturopaths in that province and look out for the public. So that is something that will always be changing, though, and then other provinces are moving towards getting regulated as well. It's a work in progress. So we'll focus a little bit on these different principles of naturopathic medicine. So we kind of have these certain principles that we are to live by as naturopaths. And so the first one here is the healing power of nature. So we really want to focus on working to restore and support the powerful and inherent healing ability of the body, the mind, the spirit, and to prevent further disease from occurring. We try to identify and remove obstacles to recovery, facilitating and augmenting this ordered and intelligent healing ability. So we really want to focus on, the body is so complicated, so complex. Science and medicine is always changing. We still don't understand everything about the body because it's so unique and so detailed. And so we really, our focus is, okay, if we remove any triggers, if we remove any aggravators, we want to, the body knows what to do as long as we give it a chance to do what it needs to do. If there's all these other factors suppressing the body's functioning, that's what we need to address and remove to let it do its thing naturally. So that's one idea. The other is identifying the root cause. So our main thing is to determine and treat the underlying cause rather than simply managing or suppressing symptoms. And this is huge because in this day and age, I mean, I think it's very important that we have access to conventional medicine. We need medications when we need them. We need surgery when we need it. However, if there's something ongoing, for instance, if we look at like type 2 diabetes, if we don't address your lifestyle, so the exercise component, the diet component, we know diabetes is really, there's a huge correlation with blood sugar levels and your body composition and all these things. And if we don't address that and we just do medication, we could be doing you a disservice because we're not even allowing the body to have a chance to function maybe as it optimally wants to. We're just kind of suppressing symptoms for the time being and not allowing that potential for healing. So that is something that I really focus on in practice, is looking at, everybody's different, everyone has a different scenario. What can we do to really get to the root cause of your particular situation? That's the key. So that being said, another principle is treating the whole person. So each person, like I said, is so unique. Someone who has type 2 diabetes and another person who has type 2 diabetes might have completely different scenarios and completely different like lifestyles, blood sugar levels even. Like there can be so much variation between two diseases that are termed the same thing. But how we deal with each person should be unique and specific. So that's a huge one. Like we want to focus on the mental, the emotional, the genetic, the environmental, the social, the spiritual, all these other factors that make that person unique. Because even like I said, for the same disorder, I would potentially in some ways treat it somewhat similarly, but also it won't be exactly the same. And depending on what medication that person's already on versus the other person's on a different medication, we have to take that into account and treat them as their own person and not just blindly give the same protocol for everybody. So another thing which I alluded to at the beginning is doctor as teacher, really that education piece, making sure we're taking time to educate people so they have an understanding and can take some empowerment and control back over their own health instead of being super, super dependent on the healthcare system because they're like, oh, this isn't my day job. I don't know. I don't understand any of this stuff, which is completely fair. If you're in accounting, how are you supposed to know all these medical terms and all these medical things that are related to your own health? It can be super overwhelming. So really taking that time to understand what's going on with you and learn about it and figure out what are the best options for you and get that perfect informed consent to know, okay, I know what the pros of doing this is. I know what the cons of doing this is. I'm going to decide to do this. That is the main thing, instead of just picking blindly because you don't understand. So that's a huge aspect of what I try to do. Another avenue is the disease prevention and health promotion. So of course, because we're focusing on lifestyle, nutrition, all these other factors, it is very preventative. That's what I always try to focus on. I want you to get to your best health state even before something happens, before some disorder appears. We want to like really make sure your immune system is functioning properly and your gut is really healthy. But that being said, if you already have something going on, there's a lot that can be done to still prevent it from progressing further. So yeah, I mean, from that we can do so many things, but I mean, the whole idea is just to really support the body as best we can and not just like wait for something bad to happen and then you go see the doctor. I want it to be before that happens so that you don't have to go to see the doctor. So our therapeutic order, basically, which kind of goes along with those healing principles, is we want to establish the foundation for optimal health on the bottom. Then we want to stimulate the self-healing mechanisms of the body, support and restore the weakened systems, address the physical alignment. We want to control and help the symptoms. And then basically the last thing at the top is the high force interventions. So we want to really create that base first, give the body what it needs, take away the aggravators, take away the factors that could be influencing the body's health. And then the very last thing is like, okay, if we need to, use a medication, get surgery, all these things, at least we did all the basics first, that we're not missing something blatantly wrong. It's like saying, for lung health, if we're going to give a medication to support lungs, well, if the person's smoking 2 packs a day and has never had good lung health, but we're not asking those questions, we're not addressing it, it's going to do the person a disservice if we don't address those things first to say, you know what, maybe let's consider stopping smoking. Let's remove those aggravators. Let's start detoxifying the lungs, allowing them to work the way they want instead of having the buildup of chemicals and tar in there. Let's remove that. And then we can see, okay, if you still need these other things, we can implement that for sure. But if we don't remove that in the first place, it's very much a disservice to patients. So another case example, she was about 28 years old, and she was diagnosed with Graves' disease, which is a thyroid disorder. And your thyroid is just in your neck here. It's a lot to do with metabolism and temperature regulation and that type of thing. And it was determined via blood work and ultrasound. That's what the conventional medicine picked up. And so it's a thyroid condition that's autoimmune, and it was really causing all these intense symptoms for her. She was losing weight, diarrhea, sweating, heart palpitations, increased heart rate, and she did not feel good. So she did not want to have her thyroid irradiated or to be on medication for the rest of her life, which is what the suggestion initially was, which that can be the right choice for some people. And I'm not saying that, but she was just like, okay, is there anything that we can do first before I make that life-changing decision? Is there anything that that I can do to support my thyroid before I completely get rid of my thyroid and irradiate it and basically kill it and then have to go on thyroid hormone the rest of my life? So I was like, okay, realistically, we're going to give it a short period of time because I don't want to keep you from following these conventional recommendations for very long. This is kind of like, we got to figure this out quickly. And so immediately we changed her diet, removed food sensitivities, which there's a lot of research with the thyroid, added supplements to support the thyroid, and changed her lifestyle habits. And from there, she was able to completely balance her thyroid hormone levels very, very well. That being said, it was only due to the fact that she was like hardcore and was really willing to make all those nutritional, take all those recommendations and do it to a T. If for someone, they're not able to do that or whatever, like it would be a little bit of a different scenario. I'm not saying this is going to be the case for everybody, but it is something that was really cool because since she was hesitant at first, it really was bothering her. She didn't feel comfortable with that decision to irradiate her thyroid right off the bat at being so young. It was really awesome to see that we were able to turn things around without jumping to that scenario right away. And that being said, if her thyroid in the next while starts going downhill again, there's always that option on the board that she can do that conventional therapy to kill off the thyroid gland. But at least she was able to feel comfortable that, hey, at least I was able to prolong and do what I needed to do for the time being, or potentially lifelong, so that she didn't have to rush that decision that was making her feel uncomfortable. So talking a little bit about naturopathic medicine and insurance. So most extended health insurance plans in Canada cover naturopathic treatments. So that's like Blue Cross, Great West Life, all those types of health insurance companies. It's usually around $500 a year that people have to spend on naturopathic medicine because it is a privatized world, it is something that patients have to pay for. It's not covered by public health. However, people do have access to some funds through these health insurance companies. So something to note. And so basically there's direct billing or indirect billing that patients, after they have the appointment, they can get that appointment up to $500 covered per year. So let's touch on these modalities a little bit more. So botanical medicine is one of the treatment options that we offer. It's the use of plants like for healing, dates back to the beginning of civilization and is the foundation of modern pharmacology, so modern drug use, like medications. The use of herbs in many forms, we use them in teas, tinctures, capsules. They are used for their healing effects and nutritional value and may be recommended for the healing effects. So an example here is willow bark, so from the willow tree, contains salicylic acid, which is the anti-inflammatory component in Advil. So that's where Advil first started, is they found this compound in trees that they realized were very anti-inflammatory for pain and inflammation. And so then they concentrated that component into what we now know as these anti-inflammatories like Advil. So it really says lots of the medications we know today came from plant constituents, but we still use the whole plant because it can provide potentially less side effects, lots of benefits. It just depends on the circumstance. Sometimes maybe the Advil is better off for you, but maybe sometimes it's the botanical medicine that might be a little more gentle, but very effective. So it's definitely something we use quite a bit. So clinical nutrition is another big thing, obviously. I focus on this quite a lot. I always look at what people are eating because food is medicine and we really need to focus on that. I offer even like specific meal plans that I create for patients, or I just make recommendations. It's whatever suits the patient best. If they want more or less guidance, we work within that. But really, like I said, food is medicine. It's all broken down in the body to give you the different nutrients that your body needs to function. And if we're not giving your body those nutrients, over time, certain things are going to start to falter and cause issue. And we need to make sure that we're supporting the body as best we can. So nutrition is a huge one because it's something that everybody does every day. You can't, get around it. So it's either you're hurting yourself with nutrition or you're helping yourself. So that is something I focus on tremendously in practice. Homeopathy is another one. I'm not going to go too deep into it because it is a little more of an abstract therapy. Some of you may or may not have heard of this. But basically, it's minute dilutions of plant, animal, and mineral substances designed to stimulate the body's vital force and strengthen its innate ability to heal. So this is something that I do use, not as often as other modalities, but certain scenarios I do use this quite frequently. And it's so gentle, and it's something that, you're really just trying to stimulate the body's own ability to heal. It's not adding a ton more that your body has to process. It's very gentle. So that is something that I use with different scenarios. So another one is Chinese medicine and acupuncture. So I focus, like you might have had this through physiotherapy with trigger point release, where they kind of jab the needle at different spots of a muscle knot. You might have had this where they stick different needles throughout the body that are on specific points in different energy meridian channels. You might have had facial acupuncture. There's so many different types out there, but basically it's based on the balancing of the flow of qi and energy in the body. And I mean, you can use herbs alongside it. And so in practice for me, it just really, yet again, depends on the person. I kind of use a combination of a lot of different things. I use the Chinese medicine theory. I use just the idea that, okay, if we find a muscle knot, we're just going to try to release that, because the knot is just an area of tissue that's really condensed and not allowing blood flow. So we're trying to, by stimulating that and kind of getting right in there, you can kind of get the muscle knot to twitch and release so the fibers are at their natural place and not all crunched up. So that's another option. Just by sticking any foreign substance in the body, you're gonna increase the blood flow to that area. You're gonna basically cause the muscle to relax by sticking a needle in tense muscles because you're not able to clench when the needle's in there. So training muscles to kind of let go. Also, I use it with electrostimulation too. So basically it delivers an electrical current that causes the muscle to contract and relax to really, yet again, control that muscle enough so we're trying to tire it out so that it can finally just relax for any tense muscle or muscles. So some people even just come in for, neck and shoulders and upper back, just to really relax those different muscles. So there's lots of different ideas there. I use it also for like mental health, like depression, anxiety. There's some good research on that for those purposes. It really just depends. It can go anywhere from like sports medicine, like injury and that kind of thing, all the way to the mental health, spiritual side. So there's a lot of applications. So case example here, another one. So this woman was also around 28 years old. She did not have a period for 3 years and was trying to conceive, and her hormones and imaging results were normal. So it's not, we definitely looked into all that. The conventional medicine side had looked into that. They were just like, we don't know, everything looks okay, nothing that we can really do. So we decided to implement acupuncture and supplements on a weekly basis to support hormonal health. And she eventually did get her period after, I believe it was like 2 months. So it is something that, yeah, it was just another cool example of how this can be used. So another thing that I look at is physical medicine. So alongside the acupuncture and doing like the different applications of acupuncture and electrostimulation, I also can do like cupping. We're trained in manipulation as well, the same way as a chiropractor, although it's just more the basics. Honestly, in my practice, I would always just refer to a chiropractor for any manipulations that need to be done, but it is good for us to be able to assess and know when different joints are subluxed and not quite in the right spot, so that we can refer and tell people, okay, you know what, like this is not looking right, you should go see a chiro, get this addressed. The cupping is really a cool thing that I do quite a lot of, and it feels really nice. Basically lifts up the fascia and the muscles to allow for more circulation and to really relax the musculature. So I do that, yeah, quite a bit in practice as well. So another case example, I had a woman, this wasn't her, but basically she had extreme swelling under her knees for about 20 years because she had a lot of knee issues, and she was just uncomfortable with it. It wasn't painful or anything. It was just kind of there, and she just wanted, if there's any way to kind of reduce it. And so we were doing acupuncture, cupping, and electrostim to really like get that lymphatic movement, get the circulation going. And we were doing it on a regular basis for 4 treatments. And honestly, her swelling, I shouldn't have said it was gone. It was just, it was much, much reduced. Like there was very little residual swelling left over. So it was just really cool to just see, okay, we can try these other approaches, see if that will help, because there wasn't anything structurally wrong at that point. So yeah, it was another way that we use that. Another example here of things that we really focus on is lifestyle counseling. So yet again, because I'm not an expert in psychology, I would still refer to a psychologist if that was something that I thought would be beneficial for the patient. However, we still want to dive into, okay, what's going on in your life? What is like, where are your stress levels at? Where's your energy? Where's all these things? Like, where is it coming from? Is it coming from your work life, your personal life? And trying to work with the person to say, you know what, there seems to be a lot of blockages here, whether it's family issues or relationship issues, and that's causing a lot of your issues, and we need to take that into consideration when I'm looking at your health. So that's a big thing that we look at as well, is we need to go into that emotional, mental side of things, and just also, yeah, know like what their lifestyle usually is comprised of. So another thing as well is testing. So I kind of said that at the beginning, that we can requisition blood work. We do the specialty lab tests as well. So all medical reports such as MRIs, X-rays, or scans are valuable assets that we also take into account from the conventional medicine side and collaborate that to see like, okay, what was going on? I like to look at all that. I don't personally, as a naturopath, I can't requisition for you to go get an x-ray, but if you are able to get an x-ray through conventional medicine, then I would always appreciate looking at that to take that into account for the whole plan that we have in place. So yeah, that's just the fact that we're trying to collaborate all this information. The whole thing is we want to get this whole rounded perspective and make sure we have all the details. So yeah, the laboratory testing, like I said, the blood work, is through the blood, but then we do a specialty lab testing that is through like stool, urine, saliva, other things that those ones you can do at home, that you send off to different companies, and they'll send us the results to give us more information. So an example of that one would be, this is, for example, like a food sensitivity test, which I listed these prior. So as you can see here, this one in particular is looking at not the allergic reaction to food, it's looking at the sensitivity side of food, so different antibody of the immune system. And it'll kind of give you like your red foods, the ones that you should avoid, the yellow is the intermediate, and the green is the things that don't seem to be causing an issue. So that's for people that, if we're trying to get more answers that maybe blood work isn't giving us, we can kind of dive deeper with some of these tests. So an example here, this patient, she was about 24, and she had a history of abnormal pap tests. So that's looking at the cervical cells. That's what women get when you're getting a swab of the cervix. You're looking at the change in the cervical cells. And there was nothing that was coming up on blood work, anything, but and it was very low grade abnormal pap test, but she was just starting to get concerned. She was like, why do I keep having these abnormals? Like, am I gonna end up having cancer? Like, what is going on? And so nothing was coming back from the conventional medicine side that they were able to pick up on. So we decided to do a specialty lab test that used the Dutch test. This is one of the ones that we use typically. And we were able to see, oh, you know what? Like, some of your estrogens are a little out of whack with the other types of estrogen. And let's try to balance out a bit more. After we had really, started a protocol to balance those estrogens, she has since had 2 normal pap tests for the first time in her life. So it's just always about trying to dig deeper and figure out what other things can we try to implement that maybe haven't been looked at yet. So another thing that I offer in my practice is I have a body composition analysis scale, and it's really cool to use. I use it with all my patients to really get a breakdown of, body composition. That's so important. If body composition is not optimal, that can lead to so many issues like metabolic syndrome, diabetes, all these things that we want to avoid. And we just want to make sure, even like your hydration status, how hydrated are you? Are you drinking enough water? This thing takes, about 5 seconds to run. And I go through that with every patient to have that as a baseline and to track and go alongside to see, okay, how have things been changing throughout time? Are they moving in a positive direction? Or are they moving more backwards? And we need to really, create some extra things to try to support why that's happening. Because yeah, obviously that's a huge thing. We want to make sure that your fat percentage and your muscle mass are optimal. And yeah, I found that very helpful to be using in practice. I also offer Berber Therapy, which I won't get into too much here, but it's something that's really cool. It's new to Canada. It's been in Europe for like 20 years, and lots of professional athletes and sports teams are using it in their locker room, because basically it's the idea that, okay, how can we benefit the body from a different perspective that's also legal with sports, by basically, this is working on the microcirculation to really amp up and make sure you have optimal circulation to all the peripheries, to make sure all the oxygen is being delivered, all the immune cells are being delivered to those areas, and there isn't any blockages or restrictions in certain places. Because, for instance, with sports, if you have an injury, if there's inflammation, there's going to be constriction in that area of the blood vessels, and maybe there's not the proper circulation to those areas as there was prior to the injury. So this is something that I use in practice. It takes about 8 minutes. It's pain-free. That I use with or without acupuncture, just to provide some extra benefit. So that's another thing that I can offer in my practice. And yeah, that, for example, for myself, Berber Therapy is the one thing that cured my knee pain. I was doing everything else for it. I had dislocated my knee multiple times in my life. And after I had used Berber Therapy for the first time, I was so skeptical at first, and I used it and I didn't have pain after that. So it was very shocking to me, and I didn't believe it at first. But that was definitely what kind of brought me into it. And there's lots of good research on PubMed and stuff like that on different cases. So it is a really cool therapy that I've added to my practice as well. And that being said, these extra things that I do, you could do something else. With your continuing education as a naturopath, you can focus on different areas that you want to focus on. You can add in different therapies like this that we didn't necessarily learn in school, but you can add them into your practice within reason. So there's a lot of flexibility there. So there's a lot of it is fun because you can make it really what you want as a practice. That being private instead of in the public health or healthcare system, there is a lot more flexibility for that, which is definitely a benefit. So let's jump into the education side a little bit more. So like conventional medical schools, naturopathic medical programs require applicants meet certain prerequisites from your undergrad. So you basically need a degree first, like your undergrad degree, but within that degree, you need certain classes. So they probably are changing slightly throughout the years, but the main things would be like biology, chemistry, physics, psychology, humanities, those types of things. Biochem was another one that I had to take, but you could have whatever degree you wanted. You just have to make sure that those classes are mixed in there somehow. And so licensed and licensable naturopathic doctors are educated in all the same biomedical sciences as an MD. So that is something, I think I would the slide here. So it even shows a comparison here between the different universities. So College of Natural Medicine, the CCNM, is the school that I went to in Toronto. And that's listed here for the different hours that we have in different topics. And then you see beside, Bastyr is another naturopathic college, but then Yale, John Hopkins, those types of universities are conventional medical programs. And you can see the comparison of the hours. So in basic and clinical sciences, which include like anatomy, cell biology, all those types of things, you can see how they compare to even, for instance, Yale. So we have a little bit more than Yale there, but John Hopkins has a little more than us. So it is very along the same lines there. So allopathic therapies, so dermatology, family medicine, psychiatry, radiology, all these things. So we have about 2,200, and you can see how that compares across the line. Then yeah, same going down the list. So naturopathic therapies, obviously as naturopaths, we have 600 hours. They wouldn't have any, that makes sense. And yeah, so it's just kind of an interesting thing to look at, because I think there's a lot of misconceptions around what what our education is. And that being said, which I'll get to as well, is we need to keep in mind that a naturopath and a naturopathic doctor are two different things. The word is kind of used interchangeably, but basically a naturopathic doctor is someone that has to go through all this schooling, versus a naturopath can be anyone who does like a course or anything, which is kind of unfortunate because it confuses people as to what exactly our credentials are. But yeah, it's just something for you to consider. So in both MD and ND schools, the first 2 years are really focused on these biochemical sciences. So yeah, all the ones here we have to take, and we do even take pharmacology, even though we don't prescribe medication like conventional medicine does. We need to learn and know what the different pharmacological agents are, so that we can figure out how they might interact with things that we prescribe. So we still need to know that, even though that wouldn't be part of my practice, that I would be prescribing medication. Although in BC, potentially Saskatchewan in the next little while, we might be able to get, like BC has prescribing rights, so they can do vaccines, they can prescribe certain medications, they can do minor surgery. because all those provinces are regulated differently. Saskatchewan's changing. We're trying to copy BC. So who knows exactly what will happen there. But for the most part, I mean, it's not a mainstay of our practice is prescribing medications. So yeah, education, so like I said, in the early years, it's really, we start focusing, it's mostly those biochemical sciences or biomedical sciences, but then we really integrate in other naturopathic modalities like the homeopathy, nutrition, botanical medicine. Yeah, and during the first 2 years, our credit loads are very similar to those of MD students. So those are medical doctor students. In some cases, as seen below, MD students carry a heavier course load burden than their MD students. So it's just something to keep in mind that, I mean, if you're deciding to go into this, it still is going to be quite heavy in those biomedical sciences. You can't really avoid that, unfortunately. If that's not your thing, it might not be the best route for you. But however, we will, you know, in the 3rd and 4th year, focus more on those other things like nutrition and that type of thing. So yeah, the 3rd and 4th years is where it really is distinguishable between naturopathic medicine and medical school, and much of the curriculum is devoted to non-pharmaceutical, non-surgical approaches to managing patient conditions. So you can see the different things that we would kind of be incorporating in more so the 3rd and 4th year. And so for the accredited schools, I'm not going to go through all these. I'm just going to go through the ones in Canada. So in Canada, there is CCNM, so the Canadian College of Naturopathic Medicine, that is in Toronto, and that's kind of the one that's been here the longest. And then there's Boucher in Vancouver. It's a smaller school, and it's under 10 years old. And those are the only schools in Canada to be a naturopathic doctor. Like I said, you could probably take courses on botanical medicine and different aspects of naturopathic medicine, you know, throughout Canada, but there you'd be a naturopath, not a naturopathic doctor. So just keep that in mind. So another thing to consider is, just like medical school, it will be pretty pricey. So you're gonna have your undergrad first, and then it'll be that 4-year program in either Vancouver or Toronto in Canada. And it is about $20,000 a year for just the tuition. So that is something to consider. You'd probably have to consider, you know, a bank or government loan. And yeah, it's just I wouldn't be doing my due diligence if I didn't kind of help prepare you for that. That we just need to plan accordingly, just knowing that that's what is expected. So yeah, the qualified naturopathic doctor, like I said, is the one who's completed a 4-year full-time program at an accredited school of naturopathic medicine. So that's either the Toronto or Vancouver school, and they must write and pass standardized North American board exams known as the Naturopathic Physicians Licensing Examinations, or NCLEX, in order to qualify for regulation and licensing. And so then once you pass the federal test, then you have to, whatever province you decide to work in, you'd have to write certain licensing exams for that province. And so, yeah, like I kind of mentioned, what's the difference between a licensed naturopathic doctor and a naturopath? So a licensed MD is a primary care physician who is trained to diagnose, prevent, and treat acute and chronic illness. And a naturopath can serve as like a health consultant or a wellness coach, but may not diagnose or treat illness. A licensed ND has over 4,100 hours of instruction, and naturopath is mostly classes offered online. A licensed ND graduates from a 4-year in-residence doctoral degree program accredited by the council, and a naturopath has no standard curriculum, and the schools are not accredited. A licensed MD is 1,200 hours of supervised hands-on clinical training, and a naturopath has no standardized on-site clinical training. And a licensed MD can work in a private or group practice, integrative oncology, hospitals, medical schools, and some governmental organizations. And a naturopath is not eligible to write the NCLEX National Board Exam or obtain license to practice. So those are some different perspectives. Not saying you can't see a naturopath. I'm supportive of anyone who has more of an open-minded approach and wants to benefit people's health. However, I just want that distinction to be clear, because it is it is just different. So these are some different, an example of the curriculum of what would be required in these different national board exams. So the first one, NPLEX 1, that you do in the first 2 years would have all these like pathology, physiology, anatomy, like all those types of subjects. The second NPLEX exam they do at the end of the 4th year would have more of these other more naturopath focused subjects. And then there's like a practical for NPLEX, and then there's an OSCE, where it's basically where you go around, and if anyone's seen Seinfeld, it's where like when Kramer has to be an actor for the med students, and he has like chlamydia or something, or gonorrhea, and he has to act it out, and the students you have to take an intake and guess what he has. We have to do those type of testing as well. So that's another thing that's just incorporated into the curriculum. So yeah, there's lots of different exams here. And then on top of that is the licensing exams for the provincial boards. And so yeah, fees for seeing a naturopath vary. I mean, since it's private practice, you can set up your practice however you want. Obviously there's some like normal amounts that you should follow. But I mean, the duration of the appointments is completely up to you, whatever you want to design or how you want to design your practice. It's, yeah, like I mentioned before, we're not covered through public health care. So it would be based on the patient paying out of pocket or using their health insurance that they have, which usually is up to $500. Unless they also have a health spendings account, then it might be extra that they have access to. And just lastly, like, you do not require a referral to see a naturopathic doctor. You can go see one at any time. So if there's one in your city or just town where you live, you can always just book an appointment with them, and you don't need to see your MD first to get a referral to go see a naturopath. It's just a separate option. So yeah, I'll answer any questions at this point. Just remember to fill out the survey at the end as well. And if you ever wanted to book an appointment or ask me any questions, you can reach out via my online option or call the clinic, and I'd be happy to help you guys. So let me just exit this screen share here. Okay. Is there any questions?
So I've got a question for our First Nations students that are in the audience. When it comes to the development of naturopathy over the years, has the First Nations and Aboriginal medicines impacted what you guys do? And is there an example, for example, for First Nations students?
Yeah, well, definitely, because we focus on botanical medicine, like that was something that we had incorporated within the botanical medicine modality specifically, trying to learn more about like herbal medicines and things that have been used in different cultures throughout the years. So yeah, from the Aboriginal perspective, but also from like East Indian perspective, and a bunch of different cultures that use those herbs and stuff just as a traditional medicinal source. So we definitely have incorporated that in. However, like, it's always something that like I personally want to learn more about, because obviously we get only a certain perspective of it, and there's so much that can be utilized that potentially we're not even, you know, using as much as we could be. But that is something that, yeah, it's definitely up our alley, that we try to incorporate those different traditional medicines. Yeah, I don't know if that answers the question fully, but.
Yeah, thank you. I got to compliment you. You covered everything very, very well. I'll be making an appointment after we're done.
I'm glad to hear that.
Michelle, are you going to make your contact information available for any student that may want to talk to you, maybe a little bit more? I mean, like I said, this presentation's been very intense, and it's been, you know, it's been awesome. But if in case there are any specifics, is that just go through your business? Is that how they would contact you?
Probably that would be the best option, or I could, yeah, I'd probably say that would be the best option is to go through the clinic. Yeah, and they can, yeah, if you have any questions or anything like that, I would be happy to like help different students out. But yeah, I definitely think I can leave that information with you guys or whatever after as well.
Perfect. Yeah, that'd be awesome. Thank you.
Mhm.
Okay. Again, thanks again, Dr. Stamen, for your informative and thorough presentation to help students in their quest to make a better choice later on. So thanks. We really appreciate it.
Well, thank you guys for having me. Okay, have a good day.